Next, we are honored to have Dan Harper and Marcy Julian, who are participating in our lived experience panel.
Eliza was very unique compared to my other daughters. She had kind of her own way of looking at life that was really refreshing. And the one story that I really love is that we were living up in Cummington, and as a young girl, I was the stay-at-home dad, and I said, you can go outside and play, but you need to clean up your dresser first. And she dumps all her clothes out into this big pile, and I was like, okay, this is going to take a while, but she's doing it her way. I'll give her the space. And then she came downstairs and she said, the dresser's clean, I'm going outside to play. So I go upstairs to check the dresser, and expecting it to be organized, I open up the first drawer and there's socks and pants and sweaters and jeans, and the next one the same thing. And I was just, as a parent, your anger at level. And I went outside and said, Eliza, the deal is you clean up your stuff, then you go out and play. What are you doing? She goes, I did clean up my stuff. I said, it's a mess. You just threw everything in the drawer. She goes, no, it's organized. I said, you got socks and jeans and sweaters. And she goes, it's organized by color. And I was like, I don't know. That was like a defining moment for me, because you have this expectation of what life is, of what being a parent is, and you have control over this person. And it's like, no, you don't. You just got to roll with what you got. So we were pretty tight with her, and kept her kind of under a watchful eye. And when the time came for her to graduate from high school and go off to college, then it was a little bit of a, kind of a little bit off the chain. And sadly, my experience of it is that's when she really kind of got introduced to opioids, and things kind of started going south. Like her year started out great at school, and then just dropped off the radar. And I feel like that might be the people that she met and hung out with, and that was kind of, I think that was kind of the beginning of like real trouble. When you confront your kid and their pupils are huge, and they're acting strange, and their words are a little bit, you know what's going on, but they say, oh, you know what? I have an allergy and I took some whatever, Benadryl, and I'm a little bit loopy on that. And you're like, okay. And you want to buy it, so you kind of do. Right? But the day that you see the I can't dispute this sign, dude, a little bit of you just dies. But there's really no, as a parent, there's really no pain worse than a pain of your child that you can't fix. My experience with the medical community is that they're good at treating linear injuries. I think I may have just actually put this together for the first time right now. And addiction is such a multifaceted thing that there's no real clean way to say, I'm going to go fix it and I'm going to get out. It just needs to be this holistic approach of the person, the medication, medical assisted treatment, the talking to a psychiatrist and finding out where she's at, and really getting down to it. And as a dad, it was hard to wrap my head around all that. The thing with this disease is, pardon me, it's it's hard to know as a parent. It's hard to know as anybody dealing with this disease how to help somebody, how to offer support. Do I ask them every day, are you going to a meeting? Are you clean? Are you triggered? How are you feeling? Or do I just give them like plenty of space? Eliza was clean for 9 months. She was working part-time at a retirement home, helping the elderly and loving it. She was going back. She was back at school. She was at a local community college, doing well. I'm not owning this, but I'm also not releasing myself of it. But I took my foot off the gas, because all you want as a parent is for your kid to be okay, right? And to have that life. And on her 26th birthday, she came the night before. I texted her. I said, hey, we're getting wings. Do you want to come? Oh, I'm over at my girlfriend's studying for school. And again, it kind of gets back to what I said before. It's like, your eyes look a little bit dilated. What's going on? Oh, you're on Benadryl? Oh, okay. Right? Oh, you're studying? Oh, okay. You've been clean for 9 months. You're studying. I know you're doing well in school. I'm going to buy that. She didn't come home that night. She texted me, save me some wings. I'm sleeping over at my girlfriend's house. She came home the next morning, and she used at home, and she died on the couch in the living room with her sister upstairs, with her brother up the street, with me down the street, with Narcan in the kitchen drawer. Everything was there. What I wish I could have said to myself 5 years in the future today, or back then, is just to be open about this and to own that this is happening and own that it's scary and ugly. But there's stigma around this that kept me quiet about it. That, I didn't say, if my kid had come down, God forbid, with leukemia, I would say, oh, you know what, my kid's really sick and she's in this hospital, and not everybody in my office would know it. Nobody in my office knew that my kid was struggling with heroin because of this. And that did not serve me, and it did not serve her. And I would say, be open. There are going to be people that are going to be scared and run, but you're going to be also amazed by people that are coming to you with their arms open and their hearts. So that I just wanted to make that that statement.
Thank you, everybody, for joining us today. We are really honored to have Dan Harper and Marcy Julian here to talk with us today. They are both members of our community and have experienced with loved ones who have struggled with substance use disorder. And they've been willing to come and talk with us today, about their loved ones, but also about some of the interactions that have happened in the healthcare setting, and some of their experiences as family members of loved ones with substance use disorder, which I think is a really powerful thing to talk about. So I thank you both for being here and sharing your experiences with us to help us to learn. Marcy, I want to start with you about a bit about some of the background and things that you've experienced and wanted to share.
Sure, and thank you, Bill, very much for inviting me and Dan to be with you today. So I'm here to speak, obviously, for my own family, but for other families as well, because this is a common experience that we all share. And I also wanted to thank all of the the providers and the folks that we meet in healthcare settings and in hospitals, and acknowledge that you're very dedicated and courageous people. And we're grateful that you're there to help us when we certainly need you most. And you've made so many strides in treating our loved ones and treating us as well when we're together with them in an emergency department, for example. I also want to acknowledge that, we know that when you meet us, maybe in the middle of the night in the emergency room, you're not meeting us in our best moment. And our loved ones can be very difficult patients, and we acknowledge that as well. But I wanted to talk a little bit about, context, because stigma is a result of lack of information. It's an opportunity to learn. And I really believe that the most effective way to combat stigma is with education. People like Bill and others have done so much to bring information into the hospital, and we are seeing the impact. It's real, it's really helping. And so we know that it works for sure. It's really important, I think, to take time to understand the disease of substance use disorder. It's not something that anyone would ever choose to struggle with. It's a very difficult thing to deal with as a family and as a community as well. So I just wanted to ask, you to think about what brings somebody to your emergency department. There's a lot of questions that, you really don't know much about us and our family and our loved ones. So, that person who you're meeting for the first time, who may have overdosed, may have been prescribed a prescription pain medication as a kid as a result of a sports injury or a wisdom tooth extraction. And as a family, if somebody had told us, I've been dealing with this, my family and I have been dealing with this for 15 years. If someone had said to me, listen, I'm going to send your loved one home from this appointment with this prescription for pain, it's pharmaceutical grade heroin. Are you okay with that? Well, obviously not. And we probably would have made a different decision back then, but we didn't have the benefit of that information. So a lot of people with addiction are kind of victims in the fact that it began that way for them. They may be someone who has had a long period of recovery, who's recently relapsed, but has done a lot to put their life back together. And they really don't need to be reminded that they've failed, and they have plenty of shame and guilt about that themselves. So I just wanted to highlight that point because I think it's important to keep in the back of your mind that there's a story, and it's not that somebody made a bad choice and is living a bad life, that they do have struggles and obstacles, just like anyone with any other disease.
That's great.
I hope that answered your question, Bill.
It really did. And I think it really does stress, because unfortunately, sometimes as medical providers, we just see that moment. And it can be really hard, especially with folks with substance use disorder, where we know it's the disease that can really impact these behavioral changes, that is part of the disease, but that is not the person. That's not the whole person. That's not your loved one. That's not who they are. And I think it can be really hard, right? It's really easy when it's an asthmatic and they have trouble breathing. We have no problem saying that's their disease. But I think a lot of us have this mental block and attribute that to this person, and to know, that it's not, and to hear from you who are family members who say, no, this is not my loved one, right? This is not how they are. They're just at this point because they may have had a relapse or they may have had a downturn, and this is their disease, is really important. I wonder, Marcy, if you can, there have, unfortunately, and I know, in talking to you both, there have been some negative experiences. And I wonder if you could talk about what were some of the aspects of some of the healthcare experiences that made it negative for your loved one?
Sure. So there have been many experiences, but like I said initially, I'm thankful to see that things are moving in the right direction and that there's been an evolution in care and understanding around those issues. But I kind of want to describe to all of you as a family member what stigma looks like in a healthcare setting. It's pretty typical to see the provider walk in and kind of a veil goes down over their face. There's something different about treating you and your family. Sometimes we ask a question, it's ignored. The provider doesn't want to make eye contact with us, doesn't use our loved one's name. It's kind of a very dehumanizing experience. It can be. Conversation is clipped, short, brief, and maybe they've brought a security guard along with them to stand by. And you look around and you say, well, there aren't security guards standing around everybody else. My son is sick, and the fellow in the next gurney is in here, I think, for a heart attack or a diabetic incident, and he hasn't quit smoking or lost any weight. So, it's his disease that's brought him here, but he's not being treated the same way. So our loved ones and us, we see that, and we see the difference in how we're treated. And it's a very very difficult thing to kind of trust your provider, trust that you're getting the care that's needed, and to really have any faith in the system and wanting to come back. One example that I will use is, in years past, and this has gotten better, but in years past, it was always a question of quickly treating this person and getting them out. And kind of in our world, we call that treat and street. Get people back out there. They're pretty sick when they're outside waiting for a ride somewhere, and we all know where they end up, and that's using again. So it's a tough thing to see. I remember, I'll share this one experience. There's a young woman who I know whose brother passed away from an overdose, and she explained having that same type of experience in the emergency department where the provider really didn't want anything to do with her brother, wouldn't look at him, wouldn't use his name, things like I've described. And she followed her out into the corridor, and she said, look, she said, that's my brother. He's a person, he's sick, and he needs help. So if you can't be nice, could you please just fake it while you're in with them?
Yeah.
So I guess if it's necessary, just put on a pleasant face if you can, please.
Thank you for sharing that. Dan, I want to turn to you. We were really honored and lucky to learn a bit about Eliza in the last video. And I know that, she and you as well had some experiences that were not great with the healthcare system. And I wonder if you could talk a bit about some of your experiences with her.
Sure. I think I can reflect, or I can agree with kind of Marcy's experience. I think the first thing that comes up is the stigma of it, right? Okay, I'm walking in with my kid, I'm in the ER, I'm in the chairs, I'm waiting to be seen. She's vomiting into a bag. We're over in the corner, people are looking, and I think in the video, in the earlier interview, I mentioned that, a guy that looked like me with white hair with his kid came in, older guy, obviously well-to-do, middle class. His kid had something wrong with his knee. They came in after us. They left before us. I'm still stuck here with my kid puking in a chair. She's not aware of the way that she's getting treated. So I don't know what that particular experience had, but me as a parent, it is so difficult to have your child in pain and not be able to
Right.
fix it, and then just have any little bit of interference that gets between you and being able to fix your child's pain, however small it is, just gets amplified.
Right.
And I heard her referred to as a junkie in the waiting room. And that term just, I just hit the ceiling. You know, it just, I mean, I just shut down. That was my experience.
Right.
But inside, I just wanted to explode. I just wanted to scream. And to Marcy's point, she's not a junkie. She's a person first.
Mhm.
She has this disease. The other thing that I wasn't able to share or maybe to articulate is where I feel the medical profession could have stepped up more is the consistency of care problem. So what happened with us is Eliza had been battling this on and off, on for 5 years. And because of insurance companies and laws and finding local treatment, Eliza had to get shipped around to different places. And what happens is we send her out to California. And if she's lucky enough to see a psychiatrist, the California psychiatrist will say, oh, you know what? She also has some depression, so we're going to give her this med. And she's also withdrawing, so we're going to give her Suboxone. And she's also on. So that's all well and good, but this is just kind of like this snapshot treatment. And then who knows? The money runs out, the insurance runs out, and she's shipped back home. And then what happens? She relapses. And when she's at home and you're like, well, geez, what's going on with you? Where is my kid? As parents, what we really want to do is get to the where is my kid in this whole thing. And it's just this layer of my kid, her addiction, her Suboxone, her meds. Is she withdrawing from the Suboxone meds? Is she withdrawing from heroin? Is she, it's all these different layers. And when I have the situation of her going from one treatment facility to another, and Dr. A says, I want her on X, Y, and Z, and Dr. B says, oh no, she's going to be off of this, she's going to be off of that, and I'm going to try her on this new medication. And there's no baseline to make a judgment of, is she doing okay? Is this the right treatment? And Dr. A and Dr. B aren't even talking. And I think it gets back to what I said originally. When your kid is hurting and something gets in the way of the solution of getting your kid some help, it just is throwing gas on the fire of the problem. And to have this inconsistency of communication between docs. I mean, I totally understand the need for privacy and protection and FERPA and all these laws, and I deal with it in my job. But this is also the information age, and we need to have a way to let this record go with this person, to serve that person the best.
I think you bring up a really good point, and I think, we talk a lot about the negative provider or the negative staff interaction, where they use a term that is really derogatory. And I think a lot of folks understand, but what you said, I think a lot of providers don't realize that by not doing something, you're kind of being negative as well, right? If you're a primary care provider and you are not addressing their substance use disorder and you're not following along and you're saying, this is not my area, I'm going to leave it to a specialist, then all of a sudden, like you say, I mean, you lose that consistency, you lose that person who really can follow someone along and see how they do. And I think, it is a really important point that part of it is that we are lacking that we do sometimes rely and say, hey, this is not my job. I'm going to refer you to someone who's a specialist, which, can work really well, but can also mean that they just see one person and that specialist doesn't address their other problems or doesn't see the whole person. And so having more of that consistency is, I think, as you said, is really important. I appreciate that. Um, in thinking, so it sounds like really um, any type, and even, Marcy, you kind of brought up, it cannot even be in what we say, but even the things that happen, the people you bring along, the things that even happened before, you even got in the room, right? Maybe
Right.
someone, took someone's belongings and said, we're going to lock these up because we don't trust you, and things like that. Um, I wonder, for either of you, were there other, there's obviously the person that says the wrong thing or refuses treatment, but I think there can be these, call them microaggressions, call them other things that stand out that we maybe don't even see. And I wonder if there are other aspects of that we need to be aware of as healthcare providers to say, you know, even though I'm just walked into this room, I know this person has already been treated differently. Um, I wonder if there are other examples that you all have of things like that we should be aware of when your loved ones are getting treatment.
Well, I actually was thinking about a recent experience that our family had. So, just like everybody else, our loved ones are not defined solely by their addiction. They have medical problems independent of their addiction, also from time to time. And uh, our loved one was treated for what appeared to be COVID-like symptoms and was hospitalized earlier this year, um, and had been in sustained recovery, and was doing quite well, but got sick. Um, and kind of funny, I thought of this while Dan was speaking, that electronic record.
Mhm.
Um, so it was obvious. I mean, the people treating our loved one knew of the other health issues involved in the substance use disorder, and a prejudgment was made by some of the staff. In fact, one provider said, "Well, I see you're still at it," and
Yikes.
nothing. Yeah, and nothing our loved one said could move the needle away from that attitude. And it was just, kind of like um, another brick in the wall, of I'm never going to be able to put this behind me and be something other than, my addiction. And it was very troublesome. Obviously we couldn't be with our loved one because of the restrictions, and it is something that he's talked about quite a bit. I know that it was really bothersome.
Yeah.
So, you know, um, apart from what you refer to those microaggressions, uh, there's also kind of an unwillingness to believe that it's possible uh, for somebody to change, and to not be trailed by that presumption that they continue to do bad things to themselves, and they kind of deserve what happens to them. So um,
Yeah.
that's just one example of something kind of recently. I hope that answered your question. I'm not sure.
No, it did, and I'm really sorry to hear that. I think as you say, that is another area that we don't do for other diseases, right? If I look in your chart and see that you had, a heart attack, but you're there with coronavirus, I'm not constantly referring to your heart attack, right? I'm not judging, what meal you decided to get on your tray. And again, it's just another way of how we separate substance use disorder, whether it's consciously or unconsciously, right? I think, sometimes providers can have good intent saying, no, maybe you are because you have substance use disorder and you look like you feel sick, so you must be in withdrawal. But to really not assume that and to say that, as I think we've talked about in some of the prior lectures, that it is a disease, and like every other disease, there are going to be times where it is stable and controlled and times when it's not. Um, I do want to shift gears because you mentioned some of the evolution that you've seen and hopefully, some of the ways that healthcare providers have changed for the better. Um, and I wonder if you could maybe talk about some of those, something that was impactful, something that, a provider did that along the other way that really helped your loved one or made a bit of a difference.
I'd like to actually jump in and maybe answer your last question and your current question. I think then one example of where I think my experience with Eliza in the medical world kind of fell down was kind of getting back to Marcy's point. So Eliza is in the ER because she was withdrawing from heroin. But it's not like, oh, she's here for a broken leg. It's just this one thing. We're going to cast it and send her out and she's done. It's more of a holistic thing, I think, at that point where it's like, okay, the addiction is one thing, but there's also because she's struggling with an addiction, there are other causes to that, right? It's not just one person there with one problem. There's her entire environment. And I think, kind of taking into consideration, does she have like depression? Let's look at her chart and let's take a look at the whole person, I think is really kind of what I felt was missed. And also I feel like, the communication to me about it there wasn't a really clear communication from the medical professionals to me of what I was in for. And I really also wanted, take ownership of the fact that I'm the parent of somebody struggling with OUD, and I don't want to admit it. I'm suffering from the stigma of this. I'm not talking to my buddy at work about, I've been up all night long worrying about my kid overdosing and dying because she's addicted to heroin. I don't tell anybody at work about that. Right. I'm not getting support. I'm not, so I might not even be open to this information. So I just want to throw that out there.
Yeah. I think that to talk about that, that's a really great point, that it's not about not bringing it up, right? If someone comes in with substance use disorder and maybe has something else going on, but the way, and actually I've had a lot of, I think, really nice reactions of asking, and folks saying, I'm, like asking, I see you're on Suboxone, how is it going? How are you doing? And people saying, I'm doing well on it, I've been on it, and congratulating them. And I think there is all of a sudden, like, you recognize not only just my substance use disorder, but you recognize my achievement of being stable on it.
Absolutely.
There is trust that's just even just from doing that can be immediately built. I appreciate that. Sorry, you were saying otherwise.
Well, I want to kind of go to the flip side of that coin, and what I think the medical world where they get an A+ in my book is people like Ruth Potee going out into the community, and to give her a shout out, and Marcy's group, Learn to Cope. Learn to Cope is a great resource where I learned about this disease, and I met Ruth Potee, and she and her crazy compassion for informing people about this disease got through my thick skull that it's nothing that I'm doing wrong, it's nothing that Eliza's doing wrong, it's a thing, right? And explained very nicely with graphs of where your mindset is when you're on heroin, and where you crash and your dopamine's down here, and like all of this kind of scientific stuff behind it. And it's like, oh, you know what? I kind of have my kid back who now has this disease. And so she took the time to explain to us in that room, what that really means. And for me, that personal breakthrough gave me my daughter back. And that was huge.
That's great to hear. Marcy, you had mentioned before, and we had talked about some things that you had noticed that were improving, that were good, that healthcare providers were doing better. I wonder if you can comment on that.
Sure, and I think it's as a result of efforts like this, and what Dan's talking about, and Ruth Potte's a warrior, and she really stepped up, and I think it has played a large part in mobilizing folks in Western Mass to look at things differently. So as a result of that, there's some wonderful programs that have emergency departments have initiated. At Bay State and Mercy and many of the other area hospitals. And one in particular is the STAR program at Mercy. And we've had a little experience and a really positive one where we we sought some help and some treatment. And you could tell there's been top to bottom training done in that emergency department with all of the staff, starting with the triage nurse who addressed my loved one by his name, took the time to ask him how he was doing, to have a little conversation with him, was warm, smiled, and just showed a kindness, kind of like what Dan was talking about, and listened. Didn't cut him off, and said to him, validated, I know that this is so hard for you, and I'm sorry, and it was such a positive experience, that I think that if it was necessary, we could go back there. He would be willing to do that. And we know that stigma is the number one reason that people will not seek treatment. That and the fact that there's not enough of it. So I think that by making those improvements and those changes, it's easier to engage people in treatment. I know that as a family, we came away feeling entirely differently than what Dan described about the evening he spent in the emergency room. And I know exactly what you mean, Dan, sitting there and, knowing you have to stay calm, you have to stay cool, but you're really raging inside because of the injustice of what you're experiencing. So these are positive things. And I think that we're headed in the right direction. And again, it's the conversation, if it continues and we continue educating and learning, things can only get better, I hope.
That's great. I'm happy that you had that experience with such a great program. And I do want to point out, because we have a whole variety of medical providers who are in attendance, and some that even aren't medical providers. Nothing that we have mentioned has been to do with medication dosing or specific technical medical things, right? These are basic human things that anyone in any level of the medical field can do and can recognize, right? Nothing has been specific to physicians or nurses or social workers. And this is really the goal of the conference, is to say that, hey, there are things that all of us can do to make people's experience and trust in the healthcare system better. And really they, trying to break down that wall, they're not that hard. It kind of boils down to treating people as they should be treated, as people.
Exactly.
And I think that's really important. And I thank you both for that. I admire both of you. You not only have these experiences, but you both have taken it and contributed back and tried really to help others. And I wonder if you could, briefly tell us about, the things that you do, that you have done that has really really help the community. Dan, we can start with you.
Sure. So Eliza, like a lot of other people that are dying of an opioid use disorder, died alone, mostly because of stigma. They're using in the Starbucks bathroom alone. They're using in their bedrooms alone. They're dying alone. They do not want to die. This is an accidental opioid overdose, probably because of fentanyl, carfentanil, whatever. But the fentanyl, I don't need to go into the medical part of it, but obviously the breathing is suppressed. They're not able to call out for help, and they pass away. So my thought, being a programmer, I during my day job, I write programs. I've written iPhone applications. I needed something to be a voice for Eliza at that moment. I know through Learn to Cope and the opioid task force that we have a clean needle exchange for kind of harm reduction, that people are doing things. They're using a little bit of heroin first to make sure that they're not going to overdose. There are things that they're doing to make sure that they're going to be okay, that they're going to come out of it the other end still alive. So I needed something to say, okay, well, if my breathing slows down, if a vital sign, is there a vital sign I can get a hold of that they can have some wearable tech that says, you know what, my dad's just down the street. Can you call him, have him grab the Narcan and come in and hit me with it and bring me back? My sister's upstairs, my brother's down the street. And what we're working on right now is a product called Eliza's Watch, which is just going to be wearable tech. Either a watch or a ring. We're still working on a few prototypes, and we have some rock stars on the team helping us out. Thank you very much, Bill. And we hope to be testing this thing, and I would love. It's my goal that anyone using drugs goes to a place like a Tapestry to clean needle exchange, gets clean needles, brings her dirty needles, and oh, you know what? Here's a watch. If you want, put it on, turn it on. It will call somebody if you need help.
That's great.
Pretty simple.
It's really, I think, amazing, and where you've taken it and the work that you've done on it has really been amazing. Marcy, we've mentioned Learn to Cope a few times. I wonder if you could tell us about what Learn to Cope is. And
Sure. So, much like what Dan described, when, we find ourselves in this situation, we can do something positive too, So, I felt that I felt a need to do something, and there's not an awful lot we can do for our loved ones sometimes. But as families, we can get support and we can get healthy again. And because there's, we're a family and we have to stay a family. But that's really something that substance use disorder can disrupt and can destroy. It is a family disease. There is no question about that. I am convinced, and no one will ever convince me otherwise. I have to say that. So I got involved a number of years ago as just getting support for myself with Learn to Cope. So it's a peer-led support organization that was founded by this wonderful woman, Joanne Peterson, 16 years ago. And it grew from one group into there are 25 now. Of course, COVID, much like our loved ones, COVID's been a really isolating time and we can't get together, but we're doing it on Zoom. So we still are holding support meetings on Zoom. And if anyone would like information about how to connect somebody to this, please Bill will let me know and we'll get that information to you. So we have these weekly meetings. We also provide Narcan to families. We do a lot around education. I know I'm kind of a broken record about that, but that is something that enables us to be whole again, is to learn and to, like, I think Dan so eloquently put it, it was nothing that he was doing wrong or that any of us are doing wrong. We have to learn about it. After all, Dan's a computer person. I'm a lawyer by training. This is not something that we were prepared for to happen. So there's an online discussion board that is available 24/7 to anybody who can't or doesn't want to be involved in a meeting, and it's just a great way to cope and to manage what life throws at you. So I ended up transitioning to work for Learn to Cope, and I'm kind of proud to say that. In that time, we brought 3 support meetings to Western Massachusetts. And more recently, I retired, and Learn to Cope has brought a Spanish speaking meeting to Learn to Cope as well. So families, families from that community can get the support and help they need as well.
Perfect. Thank you. And we will in the chat post a link to the Learn to Cope website for folks and
Thank
give
you.
resources for those.
ElizaWatch.com.
And to Eliza's Watch. I didn't know there was Eliza'sWatch.com. We will post as well. Dan Harper, Marcy Julian, thank you so much for talking with us today. I think it really helps us as healthcare professionals to hear and to learn from you. So thank you for taking the time and sharing your experiences.
Thank you.
Thank you. You're welcome.